Hi, this is Dr. Cameron from Trimodus, and I feel as though you probably got a package in your mail and you've got a bunch of peptides in there. So here's what you're gonna do. You're gonna grab the package, you're gonna open it up. In that package, you are going to receive a few things. You're gonna receive not only your peptides, but you're gonna receive a bottle of water. It's called bacteriostatic water. You're gonna receive your peptides. Now it's gonna be in a vial similar to this. You might have CJC or BPC or something along those lines, or you might have two, and you just got to follow the instructions, and we'll move into that in just a second. However, you'll get not only that water in your peptides, but you're going to get a little syringe, and you're going to get a needle, and then you're going to get a big package of these insulin needles. So all you have to do is you have to read the label. On CJC or BPC, you're going to get a vial that's filled with powder, and then you're going to get this water. So what you're going to do is you're going to take this water, you're going to pop off the top, and once you get that top popped off and the top popped off of your peptide, you're going to read the label, and it's going to say inject 7.5 milliliters or 6 milliliters of bacteriostatic water into your peptide. And so how you do that is you would take your syringe that should have the appropriate number. Sometimes they'll give you 5 mLs, or they'll give you a 10 ml syringe. You just have to do math. If they want 6 mLs or 7.5 and you only have a 5 milliliter syringe, you just have to do 5 and then add another 2.5 for if it's 7.5. Then you're gonna put a needle on it. So here's the needle right here. And then we're just gonna turn this around, and now you've got it screwed on. What I do is take a alcohol swab that's provided, or you can grab one and just swab the top of these little vials, and then take your needle, take the sheath off. Then from here, we're gonna upside down bacteriostatic water. You're gonna put the needle inside the middle portion, push some air into it, because you're gonna take a lot out. So I want you then to take out the necessary amount. So you're gonna grab that, and then what you're gonna do is you're gonna take, let's say it's 7.5 mLs in the syringe, and then for the peptide, you're gonna just put this into the top, and what's gonna happen is a lot of the times it's gonna naturally push all of that water into it. And that's what they call reconstituting. So then you just swirl it around, it's ready to go. Now make sure that you store all powders and all liquids in the refrigerator. And if you would like, you can keep the powdered version in the freezer if you'd like. The shelf life with a powder lasts about 2 years. With refrigerator, it's over 6 months to a year with the liquid. So that's what you're gonna do for your peptide. And then what you're gonna do is you're gonna look at your prescription, and it's gonna say inject 10 units every night or inject 25 units every day. So that's where you're gonna use these little needles. And what I do is I take a little air out, pop the top, turn the peptide over, push the needle in, push some air in, take the units that you need out, and then from there, it's ready to go. I typically use it right in the belly. So subcutaneous fat is accumulating all around kind of the belt line. I prefer probably 5 o'clock and 7 o'clock to my belly button. So if my belly button's the center of the clock, we'll hit 5 or 7 o'clock, and you just alternate, every day. Pinch the subcutaneous fat just a little bit. Don't pinch it really hard, but just get enough out. You're gonna inject, you're gonna get your needle in, inject the fluid in, pull it out, you're good to go. It might sting a little bit, might get a little red, that's all normal. Good luck, have some fun.